Hi, I'm Sandy Wheeler. I'm the CEO and majority shareholder of a company called VCARE Health Systems, Inc. That is a company that we chose to put the medical device that I'm going to explain to you today about, called the VST. I was also the co-inventor of that with a fellow by the name of Steve Petrosky. Steve is a very unique guy, tremendous medical background, and he was also the electrical engineer who was responsible for the development of the robotic arm for the space shuttle. Steve worked with us to take this wave and truly make it unique, that for whatever reason the body truly loves it. The wave that's housed within this piece of equipment really kind of mimics a defibrillator wave. And of course our whole body is made up of electrical waves, and that's how our body communicates with blood vessels through nerve paths. And that's one of the things that goes wrong when we have neuropathy, is that whole chain of communication gets interrupted. So Steve was able to take that, make an incredible wavelength that the body loves and responds to. We started to develop this piece of equipment back in 1995, and at the time I was building another company that you might be familiar with. It developed a piece of exercise equipment called the Bowflex. And I had had several knee operations, and I was just after a piece of equipment that would take the swelling out of my knee. And so Steve worked with me and along with a surgeon friend, and we developed the VST. And in 1996, we went through what's called an FDA process to get 510K approval. And since that time, we have treated thousands of patients for various medical diagnoses. Then in 2006, we were billing incident to physicians, which just meant we were getting the physicians' patients and we were treating them with the VST in their offices. And all of a sudden we got a call from a couple of the doctors asking a question about, were we familiar with what our equipment would do with the treatment of neuropathy and neuropathic pain? And quite honestly, I didn't even know what it was about. And so I said, well, not really. And they began to tell us the results of some of their patients. And in fact, two of the doctors went on to publish a report on the benefits and the results of a study they did on neuropathic pain. And the results were quite astonishing, where they impacted 70 to 80% of that population that they treated. Unfortunately, in today's world, medicine is changing, and not necessarily for the better. And as a result of that, as we see Medicare and the other regulatory agencies begin to disallow treatments that for the common man just doesn't make any sense, we sat down with our team and we tried to figure out a way in which we could deliver this particular treatment protocol and still benefit the patients that are out there and not see it as an area of medicine in which they really didn't care about. So we sat down with our legal team and we came up with a way in which we believe will allow you to treat in the comfort of your home utilizing the VST. I might add that since 1996 and that FDA approval, we have not had one case of any kind of medical malfunction or medical side effect from the utilization of the VST, which not a lot of people can talk about that, but it just shows you the efficacy and the safety of this piece of equipment that you're considering using. We're also a cash pay business, and that's the way we had to structure this, in which we could work and be able to hopefully service every patient who has a desire to get well without having regulatory interaction into us and driving our costs where we might not want it to go. Our whole goal is to get you well through the utilization of this VST, to allow you to treat in the comfort of your home and thoroughly enjoy the process with the hopes of getting you well. The VST does an exceptional job in this arena, and for neuropathic pain, we run in that 70 to 80% success rate of dramatically changing various symptoms of neuropathic pain and the other symptoms that are involved with neuropathy. Our other goal is to be able to treat every patient regardless of financial worth or means. As part of that process, we also had to be rid of the Medicares and the private payers so that there would be no dictation to us of how we wanted to do that. So that will also be our goal, is that we never have to turn down one patient. We're able to treat you if you have a desire to get well, and we have a desire to treat you, that we can come to a way in which you financially can afford that treatment. Also, our dedication of our entire team is to service you. And to that point, I've always been a real stickler on that. Because from time to time, we are a company, we do have people, and it's inevitable that someone will make a mistake along the line and not meet your expectations. And I think it's more than just saying we're sorry, we want to go the extra mile for you. So one of the things I've always believed in is I am going to give you my personal cell phone. And if any time in the future what we do as a team doesn't meet your expectation, I want you to have the freedom to call me. So take this number down. Number's 509-670-9068. And I want to tell you again, thanks for trusting us and let us come into your world to work with you on your medical condition. And we're really looking forward to working with you. Thanks a lot.